I think people are like blown away. They're like, wow, you don't want to take all my money today? And it's no.
Yeah, no.
If it's not going to help you, no, we're going to start
No.
baby step a little bit too. We're not going to jump right into some of these more advanced
Yeah.
treatments if they're not ready for it.
This is MedSpa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate D, and I am privileged today to be interviewing Amanda Lemmage. Amanda is a licensed esthetician and laser tech and longtime owner of Skingevity Med Spa in Spring Park, Minnesota. She's a business coach and speaker and also a podcaster. She has her own podcast called the All In Wellness Show, which I had the privilege of being on not too long ago. So Amanda, thanks so much for coming and speaking with me today.
Absolutely. Thank you for inviting me. It's a pleasure to be on your podcast as well.
Yeah, well, we had such a great conversation before. I just thought this would be a great venue to just explore some of our favorite topics because we touched on a couple things that I think we're both really passionate about. So today, I think we're going to try to cover is our thoughts on neurotoxins, also on lasers and all their various uses. And then we should totally have time to talk about the recent laws and the changes that are governing the med spa industry and how that's affecting our med spas. So how about we start with neurotoxins?
Okay.
So I'm curious to know which neurotoxins. So there are more than just Botox in this country, right? There are a bunch of neurotoxins that are now FDA approved for use in the US. Curious to know which ones you carry in your spa and why. And we can talk about like why we like them and why we don't. So which ones do you carry?
We offer all the neurotoxins that are on the market. However, we really prefer to focus on the ones that we see the best results with, which is Dysport. And we do offer Botox, at a patient's request. We always have it on hand, but we prefer Dysport. And we haven't loved the results with Xeomin or Jeuveau, just the results are not substantial, right? We just love the quicker onset with Dysport, and we tend to get longer lasting results with that neurotoxin, and it's one of our patients' most favorite as far as how they respond. It's a more natural look, and it is something that they feel like their investment. I think they see better results with that, and it's definitely our go-to when we have the 2% that's out there that maybe become resistant to Botox, after they've been maybe having that administered for many years. And so Dysport's definitely tends to be our last resort, and we've always been successful with that. And we have been using Daxxify for the last 2 years plus. We do love that. We haven't had anyone with a bad result, which is great. We're one of the first in our state, and we had been using the RHA filler line, which was a prerequisite to carry Daxxify, and we've had great results. But that one we find treats like a Botox, so it's not for everyone. It's definitely not for a newbie, that's new into neurotoxin. But we do have some patients that come in the door and they just ask, "Can I just start with Daxxify?" And they haven't done any other neurotoxin previously. And we will decide case by case, I think, what's best for each patient, right? And I'm curious what you feel there too.
Yeah, well, I feel very similarly. I think so. I think it's helpful to explain how these neurotoxins are different for our audience. So Dysport's also my favorite. So the way I tend to explain it to patients is that, Botox is the best known in the States, but Dysport is the number one in Europe. And it's a close second in the US and is gaining ground on Botox, which of course I'm sure makes the manufacturer happy. But the reason I like it is that, we basically draw it up, dilute it exactly the same, and we charge the same for Botox and Dysport. So, but Botox tends to take 1 to 2 weeks to set in, whereas Dysport is quicker. It's 3 to 5 days. So quicker onset. And then Botox tends to last 3 months, and Dysport on average tends to last 4. Now there's a range for everybody, right? Everybody's individual, but for the most part, you'll get an extra month out of Dysport compared to Botox. And if it costs the same, then you're looking at more bang for your buck with Dysport, right?
Right.
And we've had really great success. It does kind of feel more natural, more kind of easy rather than sort of stapled. I don't know. That's like that Botox just seems a little stiffer, right? So there are a bunch of other neurotoxins. And so Xeomin is one of the next one that was FDA approved. And so Botox, basically it has these 2 active subunits and a big protein coat around it. Okay. But when you dilute it into saline, then the protein coat floats off and you're left with the active form of the toxin, which is the same across all of them, right? The protein coat's just sort of floating around in the fluid, right? So Dysport is different. It has a smaller protein coat, but the 2 active subunits are the same. Well, Xeomin came out and that has the 2 protein subunits and no protein coat at all. And the advantage of Xeomin was that it's stable as a powder, so you don't have to put it in the fridge. Like you can ship it, you can fly on a plane with it. And I think that's why if you go to a course, they're always injecting Xeomin because that person could get on a plane and travel with it. Whereas with, Botox and Dysport, it's really hard to do that. But what we've found is with Xeomin, it just does not last as long. It takes the full 1 to 2 weeks to set in and then lasts maybe 2.5 months. Is that your experience is too?
We especially noticed that we were needing to retreat anyone that had Xeomin administered, and some of those, if they have a naturally deep set line, we're going to need to add more, right, to get a substantial result, especially if they're new. But we always noticed that with Xeomin, we would need to tweak every patient, and we don't see that with Dysport. We really don't see anyone calling in asking for additional tweaking. And with Xeomin, that was hard because I feel like we were chasing the lines and we didn't see as long a lasting result. And so that's hard as a business owner, and for patients with them investing in it, we want to see substantial results, right, that they will notice. And especially with building rapport, because they'll question us and say, well, why isn't it working? Maybe I should try someone else. But that's really not the case. And we just really don't use a lot of it. It's good for someone who's brand new, we found, that's a little hesitant. I feel like it's a little more natural. You have some celebrities that were endorsing that product. And I think
when they got paid to do that, those guys went away though. Won't say who it was.
Right.
They stopped. Yeah. I mean, I think that the proof is in the pudding, right? So if your patient comes back and needs touch-ups all the time and it's the same injector, whereas the other product, you never need a touch-up, then perhaps it's the product and not the injector. So yeah. And then there are a couple more. You mentioned Daxxify. So I did try Daxxify. We did a whole little trial of it, and we did not find that it lasted longer than Botox. So the big selling point when Daxxify came out was that it lasts 5 to 6 months, and we did not see that at all. There are people who claim that and still, but in our hands, and we're between us, we have decades of experience. It did not last a single day longer than Botox
really
did.
Interesting. Yeah, we had different results.
And really well, and I just found like they were charging way more than Botox, and so it didn't justify the extra cost for us.
And we did some training, and we were fortunate enough to have one of the trainers that owned or still owns medical spa, and so we went with her pricing, and it really wasn't double the price. It was about 20% more, but she really did some cocktailing on pricing per area versus per unit, and then starting off with 20% to try it. And then if they loved it, then they would invest a little bit more. And just with the dosage, we went along with what they recommended. And we did see a lot of patients, especially maybe in their 60s or that were chasing deeper lines. We saw really great results, and we still do. And so I think it's not for everyone, though. Definitely is not for every patient out there. And I think that's where you have to be careful, and see what's a good fit.
Yeah. And I always wonder if that's the case, are those the people who would have lasted longer on Dysport as well? Because, some people will last 6 to 8 months on Dysport, not many, but a subset, right? So I always wonder, if you're getting those results from Daxi, is it really because you would have gotten those results from Dysport or even Botox? We don't, sometimes. Right. So, and then there is Juvo, which we did a very brief trial of nobody liked it. It essentially is pretty close to Botox as far as how it acts. It's definitely, if you look at the amount of toxin by weight in the jar, it's about the same as Botox. And we did not see an advantage. So it was hard to justify bringing that on. And I'm super curious to know, because the most recent one FDA approved is Latibo.
Have not used it.
And I've not used it either. It's brand new. And normally when a new toxin comes out, I'm overwhelmed with requests by the local rep to sell it to me, right? and nobody's called me about Latibo yet.
Same.
So I'm kind of
it's interesting.
curious. So I kind of wonder if they're not launch, because the industry is kind of crazy. It's very big on trying to sell you things all the time. And so what's going on with them? Are they not launching big, or is it an issue or something? I'm not sure, right? I'm very suspicious.
Yeah, there's got to be something there. And if it's FDA approved, you would think they'd be knocking at our door to get it in our hands and even demo and try it on staff, right, first. And
and that's usually what happens, right? For any new device or new product, and they're knocking down our doors. We get emails all the time. I'm sure, Amanda, we both get multiple emails a day from people who want to do business with us and use their products or use their marketing or whatever. And so to have a brand new FDA product and, crickets, very unusual.
Very, very unusual. We're so inundated. And even if we have a sign that says no soliciting on our door, we still have sales reps coming in. And
they walk right in. And you know what they say? They go up to my front desk and they're like, "Oh, I have a noon meeting with Dr. D."
Yes.
And they'll peep their head in. I know this probably isn't true, but do you have a meeting at noon? I'm like, no.
I had to train my staff, no, we do not have a meeting scheduled. And my favorite is, I'm Amanda's best friend. And I'm like, I don't even know who they are. And they're like, wow, they're really good at their job, and I'm like, you'll learn. It's very common.
Yeah, these reps they're trained a lot. I mean, they generally tend to be people who lie, right? But they're also trained to use these tactics, which are basically, lying. And I wrote a bunch about this in my book. There's a whole chapter about laser reps and how slimy they are.
Yes. And I'm very intuitive. I'm sure you are as well. And that's what's even harder, because they're trying to sell you. And there's an approach. There's a way. It's like when I've gone into, say, Ulta or a store, and you're just immediately sold on 7 products that you don't need. And you might want to ask me what I need, maybe, or what I'm interested in first. You've already lost me at that point. I'm just going to turn around and not purchase anything.
I mean, like everything else, if you do your job really well, what you're mostly doing is educating.
And that's what we love.
And I just did an interview yesterday with some marketers who, I have to say, we're inundated with these unscrupulous marketers, but these guys were really very cool. And their point was, if we're doing our job really well, all we have to do is educate our clients on what we're doing, and then they'll want to work with us. And I'm like, yeah, I mean, that's pretty much true of anything you're doing with integrity. That's what you're doing, right?
That's our mission statement. That's our principle. And patients know when they come in and they actually commend us. They'll say, wow, you can tell you really care. You actually are willing to take the time to explain and to educate, because what's the point if we don't know the benefit of what we're doing for the patient, if they don't know why we're doing it, or especially with products too, right? There's nothing worse than getting home and going, why am I doing this? Or what am I supposed to do with this?
Right. And that's why we're here on this podcast talking about these things. So in summary, we can't say much about Latibo except that it's brand new. And I would probably leave it alone for a while until people start getting experience with it, because they won't, even someone who's got it now won't be able to tell you their experience, because it hasn't been around long enough to have any. Right. So, but our recommendation is Dysport, obviously. But, both Daxi and Botox work. They have their roles, right? And I think neither of us particularly love Xeomin or Juvo. So when you're going to look for a new place, I think it'd be great. Ask them questions. Well, what are all the toxins that are FDA approved, and why do you use the one you use? I think that's really helpful if you're brand new to using Botox or Dysport or any of the neurotoxins. Ask those questions. I think that's a great way to start.
Doing the consultation, hopefully it's complimentary. Like we do always complimentary, but I think it's important for anyone. It's very overwhelming to be able to go in and get a feel, and then you can make, based off of what the injector is, educating. You'll get a feel, I think, too, for their level of experience and
Mhm.
what they recommend, and then make an educated decision from there.
Yeah. And I think that's wise for every single elective medical treatment, no matter how you slice it, including plastic surgery too. You want to have a really informed decision. Okay, so let's move on to laser. Since you are a professional on the laser side and you've done a lot of laser treatments, I'm very curious to know like what your favorite laser or energy devices that we could include RF devices as well, and what they do and why you like them. And obviously, I have my favorites too. I know we talked about this on your podcast. So, but I would love to hear from you first. Like, what are your
Yeah. I
favorites?
really like the radio frequency to upregulate the stimulation of collagen, and definitely use that with injectable treatments and continue that as a maintenance program to continue with a collagen production. But it's also important. We love great technology. Most of it is not from the US, unfortunately.
True.
Definitely.
All right. When you refer to radio frequency, are you talking about radio frequency microneedling?
I'm talking about RF microneedling, correct?
Yeah. Okay. Because there are many just plain old RF radio frequency devices that just heat the skin from the outside.
Mm-hmm.
And I think those have generally fallen out of favor
Mm-hmm.
because they just don't do that much. They're
Right.
okay. They're not terrible, and they're nice, I guess, because they don't really hurt and there's not much
Mm-hmm.
downtime, but they don't do that much.
Right.
Whereas RF microneedling, there are many, many devices that do that. And so what happens is that the needles go into your skin and deliver a blast of RF energy that turns those fibroblasts on, those cells that make collagen. So the main reason we start to look droopy as we get older is every year after around 30, we're losing 1% to 2% of our collagen and elastin too, right? So these devices go in and turn those cells back on and make them make a bunch more collagen. And they can actually thicken and tighten the skin. So there are a lot of different brands of those devices. I'm not really, I mean, there are a couple brands I think are great and at least one that I really hate. But the main thing is to talk about what, and it's okay to mention brands here, but which ones do you like? Why do you like them? Do you combine them? A laser resurfacing, which we do actually. I'm just kind of curious.
I think we talked about it on my podcast. We like the same. Cartessa is a good one. Also, anything I love from Korea. I mean, what you
yeah.
see
So
is
actually, I have the Lutronic Genius, which is a
yes.
Korean device. Korea, K Beauty's kind of a little way ahead of the US in a lot of ways, but some really great devices have come out of Korea. And I especially like the fact that, they're all kind of tested on Asian skin, which can be super, super difficult to treat. Asian skin can tend to hyperpigment more than others, scar more than others, have a little more complications. So I love the fact that all the big trials are on Asian skin. So they're like proven to be safe. And the key thing, I think the common denominator between, the Cartessa and the Lutronic device, but also a lot of the other ones, the Matrix, anyway, there's a bunch, Potenza, that they're insulated needles. And so they protect your epidermis. They're not blasting through your epidermis. So for everyone at home, if you're not medical, what that means is they're specifically delivering the RF into your dermis inside your skin where those cells are that make collagen. They're not blasting away at the surface. And the downtime that you get from any laser treatment or any RF treatment is from damage to the surface, the epidermis, the surface layer of your skin. And so if you spare the epidermis, you don't damage it, then you're going to have way less downtime and also way fewer complications. So the issue with damaging your epidermis is you can get scarring and hyperpigmentation and hypopigmentation, and you can get those little check marks, the grid marks,
which is
that
so
people
bad.
hate.
Yes.
It's terrible,
It's
right? And people hate
horrible.
that. And so using any device with insulated needles is going to be way, way, way safer than any device with uninsulated needles. Which is why I'm just going to mention it because it's so popular. Morpheus is uninsulated. They don't offer insulated needles at all. And it's just a much higher risk profile. And Morpheus happens to be made by a company that is very, very powerful in its marketing. And so it's really captured a large market share. And even though it's a more dangerous device, and I just don't like it. So fine, I'm on
Right,
the record of like an anti-Morpheus. And it's not that, I mean, it can be safe, especially if you have very light skin. But even people with super light skin can have major issues with those grid marks and stuff. They may be lower risk for the long-term complications. But anyone with medium skin like me, or, Asian skin, forget, or darker skin, absolutely forget, right? Super
Absolutely.
dangerous. And I think a lot of these devices are in the hands of people who don't know the difference, and they do it until they hurt somebody.
Exactly. It's really unfortunate. And then they'll come to our clinic and go, "Can you help me?" I'm like, "What did they do to you?" I
Yeah,
just
what
don't
did they do to you?
understand. I
I
don't
know.
understand that. And I really am. I listen to a lot of the things. I like to demo for quite a while before I'm willing to put anything into our practice. But I see through all those bells and whistles, and you really have to listen and see results, and also work with doctors that aren't going to, make a commission off of selling or recommending that machine. And I'll never forget the first time we demoed the Korean laser with the RF microneedling. And I was just like, is this possible? Look at those results. And there's no downtime, virtually no downtime. I mean, what a difference. And just seeing that dedication to engineering and technology advanced. And I do think it's such a difference when you see that. And that's what patients are hoping to get, right? When they come in, if they can avoid downtime at all costs.
Yeah,
But
I
it's
mean,
not always the case.
there's always a bit of downtime depending on what you're doing, right? It's variable depending on how significant the treatment is you're undergoing, right? I am very curious though, besides RF microneedling, which is generally, especially if it's insulated, it's very, very safe, right? We do it on any skin type, so and it's very effective. We actually, in my practice, we combine the RF microneedling with a non-ablative laser resurfacing, same treatment. Do you guys do that
We
as
do.
well?
We do. And we love
Yeah.
that. And patients notice that. I think they really
Yes.
see the results. And
Yeah.
it's really great to see the accumulation of it too for them. It's probably our favorite treatment for preventing aging and seeing that stimulation with.
Yeah. I mean, in our practice as well, it's the most popular and the most, I can just say it's going to work. Like, there's a very variable response to most treatments in aesthetics. And we always have in our consent form, like what the procedure is, the benefits and the risks. But part of it is we can't guarantee results, right? But with RF microneedling combined with laser resurfacing, we always do a series. It's not just one and done, but it is just about impossible to do that and not get results from
Exactly.
it, over time, right? And they're slow, right? But
It is
the thing
slow.
that's very noticeable is the laser resurfacing, like that, the results from the very first one of those, you'll be able to see. And then over time, it's our workhorse, basically.
It's fun to see patients so excited, and they ask to continue the series just because they like that feeling of the skin tightening, and it's almost like you have that little bit of a glow. You get that dewiness a little bit too from the results, or if they have an
Yeah.
event, and it's really a nice treatment.
Do you actually use any ablative lasers in
We do
your
not.
practice?
We do not.
We don't either. You want to explain why, or I can
Well,
explain why I don't.
most people don't want to look like Scarface for 2 weeks. And I think in our state, there's only one plastic surgeon that's still doing that. And we just don't
Oh,
find
really?
it's necessary. It's really just
Yes.
not. And you'll have
Yeah.
some people
So
that come in and they're like, "I've watched TikTok. Do you have the CO2?" And let's talk.
But
Let's
yeah,
talk
let's
about
talk
that.
about that. Let's talk about why we don't. Yeah. So a CO2 laser is an ablative laser, right? And so kind of like what we were talking about earlier with the non-insulated needles that Morpheus has. Well, CO2 lasers ablate the skin. So they vaporize a column of tissue going from the outside in. And that is a lot of damage. So the downtime, your face is basically off for 1 to 2 weeks as it recovers and you regrow new skin. And it carries the same, actually probably the same or worse risk of hyperpigmentation, scarring, and hypopigmentation that an uninsulated microneedling would do. So it's much, much, much more downtime and much higher risks. And you really cannot treat darker skin people at all. So I would not touch anyone like my skin tone and darker. So
Right.
fits 3 and darker, which really depends on where you live, but that's not a lot of people, right?
No.
So, I mean, unless you're in Sweden,
Right.
in which case it'd be great. But yeah, so those just carry a higher risk. And in my opinion, I think I would much rather have 3 non-ablative lasers than 1 ablative,
Exactly.
right? And the cost is less and the experience is less. It's so much easier to endure and it's so much safer. So I just
Mhm.
don't get why anybody
Mhm.
would do the CO2 unless you're in an academic center or unless you're in a reconstructive plastic surgery center and you're trying to, fix congenital nevi and things like that
Mhm.
that
Mhm.
are really complicated and but then you're trying to fix a disfigured person, not
Right.
take a person and try to make them more beautiful. I've always said nothing in aesthetics is worth any permanent harm. So
Mhm.
if a CO2 laser is a 1 to 2 risk of some permanent harm, why would you ever do
Right.
it?
And for me, I
So
try to avoid liability at all costs, and we would never want to put ourselves at risk because we've never had one case, but we don't want any of those cases. And I just think it's so important to look out for a patient's best interest. And I've had a few patients that came in from other clinics and had a CO2 done years prior, and they said they were burned really badly. And it's
yeah.
very unfortunate when you see that and hear that. And it took years for them to recover. That's not something we want to enforce on someone. And if we know we can avoid risk.
Yeah, absolutely. Absolutely. And I think that I would just venture to say no one who walks into my spa wants to take those kinds of risks, right?
Hmm.
And it's up to us to explain it to them. To say, well,
Right.
this is why I don't have that. People come into my place and they ask me for something that I'm like, oh, yeah, that's not safe. So I don't have that here.
Exactly.
I just explain it to them. I'm like, well, these are the risks with that. That's why I won't buy one. But,
Hmm.
there are people willing to take those risks, but I'm
There
just
are.
not one of them.
Right. And I think patients appreciate when we are being honest and looking out for their best interests and not being greedy, I think is important too. And, if you don't
100%.
need it, I'm
Yeah.
not going to offer it or recommend it if it's not something that you need or works for you as well.
Yeah. I mean, that goes back to our previous point about educating patients. It's just, I'm never going to talk somebody into something. I talk people out of things all the time.
Too.
And yeah. And my goal is to just tell them what we can do, what we can't, what the potential benefits are, and then they can decide for themselves. Right. I'm just here to give them the information.
Right. I think people are like blown away. They're like, wow, you don't want to take all my money today? And it's no.
Yeah. No.
If it's not going to help you, no, we're going to start
No.
baby step a little bit too. We're not going to jump right into some of these more advanced
Yeah.
treatments if they're not ready for it.
I think that's another good take home point for people listening is, if someone's kind of giving you the hard sell and saying, oh, well, we have a special going on, it's only good today.
Hmm.
Or, what I really think you need is this expensive thing and you got to decide today. Or, oh,
Right.
we have, I mean, it's one thing to look at your schedule. If you're all excited to do something and say, well, let me see if we have a spot. But
Exactly.
any place that's pressuring you to do that, I would just be
Hmm.
like, I need to think about that.
Of
Just
course. Well, I
walk
think
out the door.
people want to get educated, and I think giving them the recommendation, a quote, and then they can take it home. And, they want to do their own research and make sure it's a good fit for them too, and financially. And not feeling pressured is, I think, what people want, and they know. I think they can see it. And I think too, with
Yeah.
people like that are in their 70s, I will turn them away sometimes too. If they're at an age of 75, they're going to necessarily look like that for the rest of their life. So what benefit would it be to them? I feel like it's a waste of money to do a lot of
Mhm.
injections at that point. Well, at least for
Mhm.
Botox.
Yeah, I mean, it very much depend on them. There are some 75-year-olds who look remarkably
Hmm.
young, right? But if you are pretty advanced in your laxity of your skin and wrinkles, not much is going to put a dent in that, short of plastic surgery. But if you're 70, I mean, I'm hoping to be. I'm 57 now. I think
Yeah, you look
that's not
amazing.
that far away. That's one point also about RF microneedling that we've been talking about is that if you are able to maintain the collagen in your skin and keep the thickness of it,
Mm.
then you will not be one of those 75 year
Exactly.
olds with the droopy skin. You're going to keep your skin.
Hmm.
Now, I mean, we can't reverse everything that happens as you get older, but a lot of it we can prevent.
Right.
And so that's a really big advantage.
I'm right there with you. I've tried to just be really proactive, and when I see some of my family, I wish I could have done some things for them in their earlier years too.
Well, I always tell people in their 30s if they come in for their first consultation, oh, thank goodness I got you before anything's really changed that much.
Mm-hmm.
Because I basically recommend anybody over 30 to do something to keep those cells awake. Because by the time you're 30, those cells in your skin that make collagen and elastin, they're dormant. And they're sitting there. You can stimulate them, but they're not doing anything. So, but if you can stimulate them and get them busy making collagen for you, you can prevent the loss. So when you're my age, your skin will still look great. And so we do a lot of that. I mean, I wish, it wasn't around when I was in my 30s and I was too busy in medicine and back then. But if you could go back to your 30-year-old self and do microneedling or something 3 times a year, it's like the way to go.
I've stayed out of the sun too in my 30s. And I think
yes.
that maybe that's the same. I don't know what for you, but it's definitely an advantage too. And people will comment, they're like, wow, you don't look your age. But
well,
I definitely
in my 30s, I was too busy working in the hospital, and then I had 3 kids. So I did not get out in the sun much either, but it wasn't because I was trying to do that. It was because I had no life. Anyway, so I was hoping to get to our third topic, and that is just what's going on in the industry as far as various states and laws trying to change who can inject and how med spas can practice, because there have been a number of adverse events all around the country. And I've talked about a lot of those on this podcast before. Which laws, I mean, I know that there are several things, but which laws did you want to bring up, or what's going on in your neck of the woods?
I just think that there's not a lot of awareness of some of the states that are incorporating these laws that may not have been a state that you would expect that from. But I think it's important to educate the injectors out there. The fact of needing a medical director on site, that's a big change, because that's something that not all states or clinics are doing. And I think it's important to be aware.
Yeah. So for people who don't necessarily know, and the state, literally every state's different. I don't think that any 2 states are the same with this, but in every state, you have to have a medical director in charge of the practice. It's actually their practice. It is their practice of medicine. So for instance, I'm the medical director of my spa, and every state is different as far as where the medical director has to be all day, and also how much stuff they do. Right. And so, some states require the medical director to be on site, some within a certain radius. And actually some states have no requirement. And I just found out recently because I was approached by a nurse practitioner in Texas asking me, she was brokering these medical directorships. And she said, oh, Dr. D, you don't have to be in Texas. If you want to be a medical director in Texas, I can fill your slate. Meaning she has 20 nurse practitioners who could work under me in a different state where I wouldn't even know those people, right? And I'm like, well, that would be unethical.
Very, very
unethical. And then she said, oh, well, you and I both know nurse practitioners don't need supervision. And of course, I don't agree with that.
Wait a second. No, I do not.
I'm like, I mean, actually, that is very controversial, and whether nurse practitioners should be able to practice independently. And there are many states where nurse practitioners have varying degrees of independent practice. My state being one of them, nurse practitioners can practice independently, but they're not practicing medicine, they're practicing nursing. And it's different. And the law doesn't consider nurse practitioners the same as doctors at all. No state,
No.
Nurse practitioners are practicing advanced nursing, and they're allowed to do that independently in many states. And in most states, they have to have some guidance by a medical director, or they have zero independence and they have to be under a medical director. So, but in any event, the laws are different everywhere. And yeah, so there is a movement, I think, to have stronger medical directorship. And I personally think that that's a good thing. I think there are many, many places that are operating where the medical director is never there, is not heard from or seen, and they get a check for $500 in the mail every month, and otherwise they have no involvement with the spa. And that is actually illegal. I mean, that happens all over the place, but that's illegal.
And unethical as well.
And unethical. It was, yes. I mean, you would think that'd be obvious, but there are so many people doing this, and they're just like, oh, that's just what people do. I'm like, that's totally unethical, right? That's allowing someone to practice medicine essentially without a license. And that's a felony. That's as far as I know. So I'm not a lawyer and I don't know all 50 states, but as far as I know, that's a felony in every state, practicing medicine without a license.
That's crazy, isn't it? That if people aren't doing their research and they think, oh, I'll just open a med spa. And I mean, that's a huge, huge, huge thing to make sure you're abiding to the laws and
But people
knowing,
don't think to call a lawyer to find out,
right?
right? And so interestingly, one of the states, a new law was just introduced is Texas. And so
Mhm.
we've talked a bit about Texas on this podcast, and we think of Texas as the Wild West, not just because it's the Wild West of lots of things, but it's definitely
Yeah.
the Wild West of aesthetics. And so there was a case that we've talked about many times here of this woman who died in a med spa about a
Mm.
year and a half ago. And there's a new legislation named after that woman. It's called Jennifer's Law. But as far as I can tell, I just went to a webinar about this a week ago or so. None of the proposed legislative changes would have changed anything or prevented anything that had to do with Jennifer Cleveland's death.
Mm.
So it's very strange. But
Yeah.
do you know about that? The new law in
Hmm.
Texas that's being
Hmm.
proposed?
I do, and it's I think it's a surprise to a lot of people in our industry or just widespread because of the fact that they typically Texas is a little bit more free flowing. They're
Yeah.
not necessarily enforcing those laws, so it comes to a surprise, I think, for many in our industry. But I think it's important to see and recognize this is important and see why it's being done. There's a reason, it's being incorporated.
Well, so I personally don't think the way this law is written is going to pass. But so so what happened to Jennifer Cleveland is that she was treated by someone who had no license at all to practice anything.
Mm.
Wasn't an esthetician, wasn't a laser tech, wasn't a nurse, just was a woman with no skills. And there was a medical director who is an anesthesiologist who is over 100 miles away, who was also an absentee medical director, not medically directing. And the unlicensed person hung an IV with too much
Mhm.
potassium and killed
It's just
Jennifer.
crazy. It's just
Right.
crazy.
So if you identify what the problems are there, that's okay. No one with no license should be able to do anything at
Well,
all, much less
why would
own
they
a med spa. Much
want to is my
why
question.
I well
Yeah.
for the money, right? I mean, they
But
want
to
to make
risk,
money.
yeah. I can't imagine.
I mean, if you're a phlebotomist, you should not be able to decide what you're going to inject someone into a human. But and the other problem is, right, this absentee medical director thing. There's no requirement in Texas for a medical director to be anywhere near the spa, right? It could be in
Mm.
another state. So that is also a problem, right? So
Yeah,
you would
big
think they would
problem.
be legislating who can stick a
Mhm.
needle in someone and who and maybe about medical directors. But instead, this law that was introduced specifically says stuff about PAs and NPs. And it says that PAs and NPs can't do an assessment and plan, meaning a good faith exam of a new patient. And I don't know why they want to penalize PAs and NPs, because generally PAs and NPs know how to do a good faith exam. They're allowed to do that in every state,
Mm.
regardless of whether it's a med spa or a hospital or a doctor's office. They're allowed to do that. In many states they have to be supervised by a medical director, and in some states they don't. But either way, they're allowed to do that. So weirdly, this law that was proposed targets someone completely different. And it doesn't actually stipulate that the medical director has to be in, nearby. I don't think. I
Mhm.
don't think
Which is
that's
so
part of it.
odd because you'd want them, I mean, personally, you'd want, and that's what we have is like they'll come, if they're out of town, we're going to know ahead of time or whatever it is, but they're
Mhm.
always going to be available. And that's
Right.
just, I think it's so crazy to see
Right. There
that.
has to be someone who can advise, be reachable, respond if need be. Like there has to be someone in the system who's a doctor who can treat things, right? And the vast majority of times, like the the practitioner who's there. I mean, I have an NP and I have two PAs and I have three master estheticians who work with me. And when I'm doing these podcasts, I'm here in my home office, but
Hmm.
I'm 5 minutes away from the spa. And they don't need my help day to day most of the time. I mean, most of the questions I get are business questions, but sometimes there's a clinical question. And in the 10 plus years that I've been in practice, we've had exactly one occlusion once.
Mm.
And luckily, we're prepared for emergencies,
Right.
and that was treated right away. And it was all cleared up and it was fine. Patient was fine. But yes, I did not have to go in. Everybody was
Mhm.
prepared to treat it, but I was on the phone with them every 10 minutes until I knew everything was okay. But, you need to be available to
You do.
respond if there's any important thing going on.
I mean,
And as patients, you probably think when you walk into a place that, oh, it's a medical establishment. Of course, there's doctors here somewhere, and there's, they can respond to emergencies. The vast majority of these spas around, because most of them are not legal, there isn't anyone there. So, and then the crazy thing is, if you do have a vascular occlusion because you had filler injection go bad and they can't treat it, their tendency is to send you to an emergency room. But the
they don't
problem is
know what to do.
emergency rooms they don't have Hylenex. They are not
No.
equipped to treat
Mm-mm.
a vascular occlusion. They will literally, if a patient walks in the ER with a vascular occlusion, they'll send you back to the doctor
They
who
will.
did that. But if
Yeah.
it wasn't a doctor and they can't treat it, well, now you're host, right?
Well, and the more time you wait, it's there. You need immediate attention. We've been
Yes,
blessed.
it's
We
an
haven't.
emergency. Your skin is at risk, and they have to save your skin.
They do.
That's the bottom line. Yeah, and I am, in the Seattle area where I am, I know a lot of the doctors who do what I do, and there have been a couple of times where there have been emergency phone calls
Mhm.
going around. Can you take this patient? Can you treat them?
Which is so
And
nice to have.
and it's but I mean, imagine being the doctor. There's one doc here who teaches the use of ultrasound in aesthetics,
Mhm.
and she's pretty well known. And they'll call her like, I
Mhm.
got an occlusion, or my
Right.
nurse got this occlusion, but we don't know how to treat it. Can you treat this patient? And she's absolutely disgusted by that stuff.
Yeah,
Like, she's
I
like,
think I've seen her out on social media, and we always use ultrasound. It's like, why we have to, and luckily we haven't had an occlusion, but I can't imagine when she sees a case how disgusted she
oh,
may
I mean,
be.
yeah, it pisses her off. I mean, she's very, very kind publicly. I think, and these people should not be injecting.
No.
I mean, that's the bottom line, right? They shouldn't, because if you can't treat your own complication, you shouldn't be doing it.
If you don't know how to treat it, I mean, you shouldn't be doing it. Yeah.
Well, yes, exactly. So one of the medical director's jobs is to make sure that there is a treatment plan, there's enough Hylenex in the fridge, and that, we do at least once a year kind of practice runs. We call it a code blanche because, that's sort of funny. But, like we just make sure we're all on the same page. We're up on the latest protocols. They don't change that much, but they have changed a little bit over the years on what to do. And we do have ultrasound in case of emergencies, but yeah, hopefully that's not needed very often.
Oh,
Is
there's
it
also. Oh, go ahead.
I was going to ask you what the law is in your state, and are there any recent proposed changes in Minnesota?
It's interesting. There's no definition of a medical director. So, there are a lot of clinics. I mean, everyone's required to have a medical director, have consent forms. They're readily available. They don't have to be on site, but they need to be within close proximity. And they run the spa. I mean, it's like you said, it's their spa. Everything is their decision. It's nothing that we can, even as an owner, make those decisions.
Sure,
And
of
it's
course.
very important. And we just abide to everything, and we're very well versed on everything, as well as what, they have obviously the malpractice, but we have them listed as well as additionally insured on ours. But it's just important to have all the protocols in place. And we have a great medical director. So I've heard some clinics that don't, and I can't imagine operating in that fashion. And, they're just not really, educated, and they're really risking their clinic, the efficacy and everything that's running smoothly. I think there definitely are some clinics out there that are not operating at that level that they should be, and there's.
Yeah, absolutely. Absolutely. And I think that my goal, and I'm starting to talk about this because it's about to launch, but I, along with some other people across the country, are establishing a new entity called the Medspa Board. And we're going to be issuing certifications for med spas across the country who are operating legally and ethically and meeting all the requirements. And so my hope is that spas like yours will want to get certified. It'll be some very reasonable fee, but then you'll be able to advertise, hey, certified by the Medspa Board. And then the Medspa Board will have a really great website with listings of certified spas. So it'll be easy to find out.
I think it's great.
Well, which one's certified, right?
Exactly.
Because what we struggle with, your practice and mine, is that it is really hard for the average layperson who like walks into a spa. How do you know that the place is legit? How do you know that there's a real medical director? How do you know it all looks lovely and they're wearing scrubs, and it's really hard to figure that out. And my focus on MedSpa Mayhem, both the podcast and the book, is to like give consumers enough information so that they know what questions to ask. But even for me, I mean, it's hard to figure out without having a conversation with the owner or doing a lot of research to figure out, are they really legit? You know, I had a conversation with an RN earlier today who owns a med spa, and it took about 20 minutes of me asking her questions before I could figure out, okay, are you really operating legally or not? And she's fantastic. She's great. But for every person who is, like, there are just a slew of them that aren't. So what I'm hoping is that, you know, the spas that are really top notch want to get certified. So it's noticeable. So you can tell, so consumers can really tell who are the really good players, because it's very expensive for us to be legal. You know, it costs a lot more to operate within the law and to operate at the highest quality of medical practice. These cheap places, they're getting fake products, they're not paying a doctor, they're, you know, and it makes it so they can offer things much cheaper, but it's way more dangerous.
And I actually like to position our clinic, you know, sometimes we've had patients come in, well, what do you charge? And we position ourselves in a way of, we're not like those other clinics. So, you know, we have elite injectors and protocols, and, you know, the efficacy is the highest out in our industry, but, you know, we're just not like those other clinics, and we won't be. And so we pride ourselves in, you know, being efficient and having all those procedures in place. And it's something that we don't take lightly. And I think for any patient out there, that's very important to know you do get what you pay for. And this is not something like to take lightly. You're injecting someone's face, and, you know, with the lasers, even all the things that we really need to be knowledgeable. And I think it's hard for them to know, but if they, you know, were to consult with several clinics, they should be able to tell, hopefully. But it's sad.
And I don't begrudge people if they want to go get the cheapest price and they're willing to take the risk of going to a legal place. I mean, there's always going to be people willing to take that risk. I'm actually okay with that as long as it's informed, right? So if that place is passing themselves off as totally legit and or pretending to be a doctor when they're not, there's a lot of those. And the patient just doesn't know. They don't know they're taking a big risk. You know, if you get on a plane and go to Mexico and have plastic surgery, you kind of know you're taking a bit of a risk, right? But if you walk into a med spa in the United States, it is really hard to tell.
It is.
So that's why I'm kind of going down this route. I have a lot of pretty prominent people in the industry now on board with the Medspa Board. So
I think it's fantastic.
So by the time this podcast airs, it will have just launched. I don't know if we'll have the certification process up and running that quickly, but we are going to be, our website, we'll have a placeholder website in the next couple of days. So by the time this airs, for sure, there'll be a placeholder website, and then we're going to really develop out the application process. Our goal is to make it super easy. So any place that's already legal won't have to do anything. All you have to do is supply a bunch of information and show that, I'm and then that'll be very easy. If some place is not fully, you know, compliant and it's one thing that they don't do yet, then we will just let them know, well, you know, you have just, you know, one thing's keeping you from getting certified. You don't have, you know, like your medical director is not on your website, something like that. Right.
I think, and having the credibility, having that credibility will be important.
Yeah. So, and then it's, you know, helping out the consumer to be more educated. So you won't have to know every single question to ask, because the MedSpa Board's going to ask that for you. So anyway, that's my latest thing.
I think it's wonderful.
I'm always doing yet another big project. Well, so this has been wonderful talking with you again. It's always really interesting. I always learn something. And I always ask, is there one or two pieces of advice that you would leave our audience with, knowing that our audience is pretty much a mix of consumers and also some people in the industry? But what are your top one or two pieces of advice for people to take home?
I think definitely if you're a new patient, you know, definitely get into a clinic for a consultation. They should be more than willing to have you come in for whatever length of time it is, how many questions you have, and be willing to answer whatever it is that you're, interested in, and getting knowledge of how does this work? Is this a good fit for me based on their lifestyle and their goals, long-term goals? And if they can provide you an easy, you know, answer for what they would suggest, over a time span that works for you and that's realistic, and, give a nice quote and not put pressure on. That's very important, I think, to get a good feel and try out a few different clinics, and you'll get a good feel for what's best for you. And I think for any new, med spa or anyone trying to get into the industry, it's important to find someone that is well versed in the industry as a mentor. And you don't necessarily have to reinvent the wheel, but I think it's very important to have, maybe go under someone's wing who's willing to help, and just know that it's very, very important to get educated and find someone who is doing it correctly and is doing it well.
Yeah.
And I feel like if that's the case, it's not necessarily that we're all competing with each other. It's because there's enough, work to go around, and we should be working well together. And that's what we try to do here in our state too, is just being able to, if we need advice or if we need to, sometimes it's a new product, having a team that you can bounce ideas off of, I think is really helpful, and not doing it alone, and just getting some advice, and definitely not thinking you're, know it all, or always evolving, I think is so important too, just with training and in the industry itself. That's what patients want. That's what we need to do as well.
Yeah. I mean, we should always be learning, always seek knowledge. Yeah. And that's what I'm trying to help with here. And hopefully we're doing that. And thanks for helping. Amanda, do you want to tell people how to reach you, either at Skingevity or your coaching and podcasting website?
Sure. So our Skingevity Spa is our website, www.skingevityspa.com. And then I also have my own website, meetamandalemage.com. And that'll talk a little bit more, show you about things that I'm doing, speaking and podcasting, and a little bit about my journey in the industry as well. And I've been in this industry 25 years. So it's definitely something I think people out there need to be patient. It takes many years of experience. And I worked in business healthcare prior. And so I think getting knowledge in all facets is really helpful too, and just being very patient.
And all those links will be in the show notes, so you can just click on them. And Amanda, thanks so much for being on the podcast today.
Oh, thank you so much for having me. It's been a pleasure.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's drkatedee.com. Or reach us through the website, medspamayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medSpamayhem.com.